The following is an explanation of the biomechanics in a futsal kick. The muscles being focused on will be the hamstring, which actions are to extend the hip and flex the knee, the quadriceps, which actions are to flex the hip and extend the knee, gluteus maximus, that works with the hamstrings to extend the hip, and gluteus medius and minimus, that as well as extending the hip, abducts the leg. There will also be focused on the gastrocnemius muscle, commonly known as the calf muscle, that plantar and dorsiflexes the ankle joint. Muscles can work isometrically or isotonically. Isometrically is when a muscle is firing and there is no movement at the joint. Isotonic muscle work can be of two types, concentric or eccentric. A concentric contraction is when the muscle shortens during the contraction. Eccentric work is when the muscle elongates in response to a greater opposing force. The biomechanics of a futsal kick can be split into different phases.
1. Approaching the ball. Approaching the ball should be done from an angle rather than head-on. Evidence shows that this results in greater lower limb velocity, which transmits to increased ball speed. 2. Backswing phase. In this phase, the kicking leg is cocked back before swinging forwards in order to generate a larger force. The planted leg offers stability. It is common to have the toes facing outwards here, as this increases the base of the support, thus offering the player more stability. The kicking leg is in maximum extension with some abduction at the hip point. The hamstrings are working concentrically to extend the hip, along with the gluteus maximus. The gluteus medius and minimus are working concentrically to abduct the hip. The hamstring muscles are also working concentrically in order to flex the knee, and the gastrocnemius is concentrically working to plant or flex the ankle joint. There is some eccentric work going on, including the hip flexors, the iliopsoas, and the rectus femoris portion of the quadriceps. This eccentric work is important for optimum control, and this is why it is important to train muscles eccentrically in sports. 3. Swing phase. In this phase, the leg is swung forwards to meet the ball with its momentum guiding the ball forwards, usually to pass to a teammate or score. Here, flexion at the hip is being performed, which means iliopsoas and rectus femoris are working concentrically, as well as extension at the knee. Plantar flexion remains at the ankle joint. The opposing or antagonistic muscles are therefore working eccentrically for control and stability, as mentioned in the backswing phase. 4. Foot or ball contact. This is the phase in which the foot comes into contact with the ball. There is eccentric contraction of the tibius anterior in order to perform plantar flexion of the ankle. The period of contact with the ball decides the ball speed. The greater the force and the lesser the time of contact will mean a higher velocity shot. The surface area of the foot in contact with the ball should be maximized to help with a larger increase of kinetic energy. 5. Follow through. This stage focuses around the deceleration of the kicking leg. The player is no longer in contact with the ball, however, after a high impact kick, must now fall out of the swing in a safe and efficient manner. In this stage, eccentric contraction from hip extenders and abductors and knee flexors are fundamental, as well as gluteal muscles working eccentrically at the hip and hamstrings eccentrically at the knee. If this eccentric work does not happen, the limb would stop abruptly, and this is how many players injure their hamstrings.